Hi, my name is Kayla Scappaticcio, and for this video, I'll be performing proper nasogastric placement and gastric content testing. I'll follow my general principles and safety practices, 11 rights, 3 checks, and 2 patient identifiers. Upon entering the room, I will knock, sanitize my hands, introduce myself. Hi, my name is Kayla. Is your name, I'll be your nurse today. Is your name James? What is your name? And can I have your date of birth? And that is confirmed. Are you in any pain today? Patient states no. Do you have any allergies to any medication? Patient states no. I have explained the procedure and the patient verbalizes understanding and gives consent. Sir, if at any time during this procedure, if you feel uncomfortable or any pain, raise your hand to indicate for me to stop the procedure, and I'll stop the procedure. I will then don my gloves. Give the patient his cup of water that he'll use during this procedure. This is a nasogastric tube. It is a double lumen. This is for suctioning, and this is an air vent. I will begin by measuring from his nostril to his ear, and then down to the xiphoid process. I will mark that with a piece of tape. I will then lubricate the end of the nasogastric tube. I will gently tilt the patient's head back and insert until I meet the pharynx, and then have the patient tilt his head forward till his chin meets his chest, and I will tell him to continue swallowing and sipping water until I reach the xiphoid process. And then I will gently secure the tubing to his face. I will then measure my tubing from the nostril to the end of the tubing, and that is 20 inches, and I will document that. I will then secure the tubing again and mark placement. This is to make sure that during intermittent suctioning, the tube does not move. There is an order for low intermittent suctioning. But before I do that, I will get an x-ray for placement, and I will test gastric contents, noting that the contents is greenish yellow. I will then apply that onto the testing strip, and it indicates 4.5, which is within normal range. I will now hook this the suction up to low intermittent suctioning. Turn it on. I will secure the tubing to the bed and secure the tubing to his chest, making sure that the tubing stays above the stomach. I will reassess my patient. I will discard of my supplies, report, and document, and sanitize my hands.